that today gynecology practice has changed completely. Today, half of my OPD is filled with PCOD and endometriosis.
What were you seeing before?
So earlier, people were having, problems like heavy periods and, fibroids and other things. But today, these are the problems which are affecting modern women. I mean, the statistics say that 1 in every 3 to 5 women across the globe is suffering from some kind of manifestation of.
How significant stress is affecting PCOS?
If there is something wrong here, now the periods are bound to be getting disturbed. Instagram, you have to be there, you have to be watching the latest Netflix, your DP has to look good, you need to look good. So there's so much of pressure. And on top of that, hormones are not functioning the way they should. So that's the biggest problem.
Are you seeing women smoking?
A lot. Smoking is one of the major reasons for the premature ovarian insufficiency. People at least should be made to aware that the solution to PCOS is not a metformin or a contraceptive tablet. If you want to reverse your PCOS, then you need to take control of the entire thing in your hands.
What is the ideal time to be pregnant?
Early 20s.
What is the common menopausal age these days?
Any woman who gets a menopause earlier than 40 years, we again say it's for every woman who's watching this. They must be selfish when it comes to their self-care. It's very important.
Hi, Dr. Anjali. Thank you for coming.
Thank you very much for inviting me. It's my pleasure and my honor to be here on your show.
Oh, so good to see you in person. So good to see you. You're doing wonderful job online, and kudos to you to educating all the women. So we wanted your expertise, and then this hour is to extract all the knowledge from you as much as possible. So right off the bat, getting into the discussion is that. So, in California, while I'm practicing as a gastroenterologist, I see a lot of patients with fatty liver.
Okay.
Lot of patients. And recently, I've been noticing a gender difference with a lot of women coming in with fatty liver.
Yeah. And
underlying thing for every woman, for a common denominator, is PCOS.
Yeah.
Right, PCOS. And as you all been talking in your channel, as PCOS is not a disease. It's basically a symptom. It's like a syndrome of hormonal problems. So people think, as you mentioned, people think that there is hormonal imbalance all over. So in PCOS, the underlying problem is, as you have mentioned multiple times in the videos, is maybe not the actual hormones that is causing the problems. It is actually the insulin, which is the main reason for all those issues. So before discussing about why that could be, if you can teach us and the audience in terms of what a normal menstrual cycle is and which are the hormones that we should look for so that we can understand how this whole thing works, and we can talk about the treatment options eventually.
Okay. So it's very important for every woman to know what is the so-called the right menstrual cycle. So I would like to say that there is nothing called the perfect or the right menstrual cycle. It varies from one person to another person. So there's nothing called as a 28-day cycle. A normal menstrual cycle could vary anything between, let's say, 22 to 35 days. And the flow also could vary anything between 2 to 7 days. But in case the variation occurs more than 8 days, now that is abnormal. Which means earlier, if your period was 22 days and now it's coming to 32 days, now this is a problem. In case your earlier period was 40 days and now it is coming at 20 days, now that is a problem. That could be indicative of some other problem. And obviously, the period should not be really painful. Once in a while, little bit of pain is fine for every woman, but it should not be like a woman has to take 3-4 painkillers every day. So that's also not normal, and it could be indicative of an underlying problem. There should be no bleeding in between the periods. There should be no bleeding after the intercourse. There should be no bleeding after a woman has gone into menopause. So this is what is the definition of a normal menstrual cycle. Now, the periods don't just happen at the uterus and the ovary. Now, it starts at the level of the brain. The entire story of the period starts at the level of the brain. So, from our brain, so we have a gland called hypothalamus, then a pituitary gland. So, from there, certain hormones are released from the hypothalamus, then it acts on the pituitary, from the pituitary, then it acts on the ovary, and then finally it acts on the uterus for the final periods to happen. So, medically, you also know this is known as HPO axis, which is hypothalamic pituitary ovarian axis. So, in case if there is something wrong here, now the periods are bound to be getting disturbed. So, that's why when a woman is stressed, she has her exams, she has any kind of a stress which is bothering her there. The periods are the first thing which will get affected. So that's why, any kind of stress will affect your
Is
periods.
it common you see in your practice?
Very common, very common. In fact, the modern day women, in fact, the modern OPD today, I tell my juniors also, I'm a postgraduate teacher, that today gynecology practice has changed completely. Today, half of my OPD is filled with PCOD and endometriosis. It's like, what we read in our times has completely changed.
What were you seeing before?
So earlier, people were having, problems like heavy periods and, fibroids and other things. But today, infertility, PCOS, weight gain, hypothyroidism, these are the problems which are affecting modern women. 20 years back, hardly there were any IVF centers. Today, in modern metro cities, every nook and corner has a IVF center. So, that's how the entire physiology of this HPO axis has changed in modern times.
It's amazing. It's amazing.
Yes.
I remember when I was in medical school, when you do the gynecology rotations, right? So the only thing that they keep on talking about is fibroid. It was only fibroids. Only fibroids. PCOS, they will say it's a very rare disease.
So when I did my post-graduation, of course, that was way back in 91. So PCOS was a small chapter in our books. And we never used to read that chapter thinking that nobody's going to ask this question in the final exam. And today, the statistics say that 1 in every 3 to 5 women across the globe is suffering from some kind of manifestation of PCOS. It's like a gynecological epidemic. It's huge. Like 1 in every 3rd woman is suffering from this.
Wow. So, if my understanding is right, hypothalamic pituitary ovarian axis. If there is a disturbance in this connection, the reproductive hormones are not secreted properly.
Correct.
And that could be an initial manifestation of what we call as PCOS.
Yes.
So I'm going to tell you what my understanding of menstrual cycle is. Okay, I'm going to refresh my gynecology thing here. Okay. So let's take a 28-day menstrual cycle. The first 5 days is the shedding of the endometrium, which is a lining of the uterus, and it starts bleeding because the uterus is getting ready for conception, getting ready for possible fertilization.
Okay. Let me see how much of gynecology do you remember. Then I'll correct
So
it.
first 5 days, the endometrium is shed off.
Yes.
The next is a follicular phase where day 6 to day 14, your follicle stimulating hormone is stimulating the ovarian follicles to develop.
Absolutely. Correct.
And there is an ovum inside. It's waiting to come out
Yes.
at the day 14, around 14 day. That's where the another surge happens called luteinizing hormone, LH. Then after that, let's say that ovum is released. If it gets fertilized by a sperm, then pregnancy happens.
Correct.
If a sperm is not there, then it stays for like 10, 14 days. Then it disintegrates and then the endometrium sheds. Am I right?
By and
Overall.
large. By and large. So basically what happens is on day 1 or day 2 itself, a bunch of cohort of the tiny follicles, they start to grow in the ovary. Out of that, only one follicle gets selected. This is known as dominant follicle. Now, when that follicle is growing, it is secreting a hormone called estrogen. So now that estrogen starts to stimulate the endometrium in the anticipation of the pregnancy. So when the estrogen levels they reach a particular point, now this triggers a process of ovulation. So this is known as a positive feedback loop, and then the ovulation happens. After the ovulation, the egg is live inside only for about 48 hours. In case the fertilization happens in this window, great. Otherwise, everything goes waste. So supposing if the fertilization happens, now the egg stays live, the levels of estrogen are there, the progesterone also comes in, and then finally the periods don't happen because there is no withdrawal. But in case the pregnancy does not happen, the estrogen levels come down, the egg dies, the progesterone also come down. Now endometrium has no support, so it sheds in form of a period. Now today, most of the women have a lot of, I would not say most, but many of the women suffer from what is known as anovulation. So the cycles are not ovulating. I mean, I always say, why is the damn ovary not ovulating? It's like the primary function of the ovary is to ovulate. But why is the ovulation not happening? Because of multiple factors, because of disturbance at the level of the HPO axis, because of insulin resistance. I mean, we have a lot of theories now coming up: high insulin levels, high cortisol levels, less melatonin levels. Melatonin is very good for ovaries. The imbalanced cortisol and melatonin affects the ovary, doesn't let the ovulation to happen. Then, of course, obesity, bad diet, hypothyroidism, autoimmune, all these things, they disturb the ovulation. That's the reason women are not able to conceive, So multiple problems happening because of the modern day lifestyles. So in fact, I tell this to everyone that we are actually paying the price for being modern in our lifestyles.
Right, of course. So the underlying problem is the ovum needs to be coming out of that dominant follicle.
Correct.
That needs to happen.
Ovulation needs to happen at the right time. And after that also, see, for the pregnancy, it's not just the egg and the sperm. There are a lot of things which happen around these two guys to make the right things happen. So, we need to have the right luteal phase, the optimum level of the progesterone. In case the ovulation is not synchronizing with the endometrium, then, ovulation might happen early, the endometrium is not ready. So all that, the problem is basically is the hormones are not functioning the way they should. So that's the biggest problem today.
Among the estrogen and progesterone, which is the hormone that you think that is very important?
Both of them.
Both of them.
I mean, both of them, they have their own function, Yeah, I mean, they can't be one favorite. Both of them are important.
So you need both to be working 100% quality.
Yes.
And both are under the control of this HPOA axis.
Yes, by and large.
So when there is any disturbances, then let's say the discussion that we had in the first 14 days, let's say there is any disturbance, maybe the estrogen is not secreted properly, or even after, at the time of ovulation, maybe the hormones are not secreted properly.
So I'll give you, an example. For example, PCOS. In PCOS, what happens, as the name suggests, polycystic ovary, which means that you have multiple tiny cysts in the ovary. Now, these are not really cysts. These are a bunch of those small follicles which they are developing, but none of them is good enough to finally develop into a dominant follicle and ovulate. But all of them are secreting bits of estrogen. So there is so much of estrogen, a lot of them are developing, but none of them finally ovulates. So there are multiple things which happen wrong in case, our hormonal profile is not
optimal. So if you say that, let's say if this HPOA axis is acting super, no problem at all, then all these issues will come down?
So, we as doctors, we know that everything is interconnected. It's not, we cannot say just the hypothalamus and pituitary. For example, somebody is obese, somebody who has a a lot of stress. She'll have a lot of cortisol. She's not sleeping properly. She'll have less melatonin. So even if things for some time are fine at this place, probably the end result may not be the right thing. So there are multiple things, like hormonal system is not just about hypothalamus and pituitary. There is a thyroid, there is adrenal. So, everything has its own role. They're all interconnected.
So in let's say a patient with PCOS, how significant stress is affecting the PCOS?
My experience says that stress is a very big, reason, very big reason. In fact, we are actually in the process of writing a paper on this. 4 years back, I always used to see that women who are working in a BPO sector, they have more PCOS. It was a very small observation. Then I started reading, I started researching the literature, and we found out that there is a connection between sleep and PCOS. And this was a real clinical experience of a gynecologist, that women who are not sleeping or not sleeping adequately, not sleeping according to their day and night rhythm, tend to have more of PCOS. So, stress also. In fact, there's another observation which I have seen in my clinical practice, that the story of PCOS starts when a girl is in class 10th or 11th. This is the time when there is so much of pressure of studies. She has to go for her tuition classes. The parents are after them. You have to study, 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 prepare for your exams. She's constantly sitting in front of the computer, not really moving. The mother is giving all the goodies to her to eat. And, there are other pressures on Instagram. You have to be there. You have to be watching the latest Netflix. Your DP has to look good. You need to look good. So there's so much of pressure. And on top of that, wrong dietary choices, lack of exercise. And then when you go to the hostel, you don't get the right food. Unfortunately, today we don't have much avenues for people to go out and, exercise or move their body at least. I always tell this to people, 20 years back, nobody did a yoga class or nobody went to a gym. Our grandmothers, they never had PCOS. So what is it which is going wrong today, which is making the modern woman getting more prone to developing PCOS? Of course, most of us think that we are eating right. Most of us think, 30 minutes of gymming or yoga is good enough. But our mothers never did that. Our grandmothers did not do this, but still they did not have PCOS. So probably they never had stress. They were physically active throughout the day, and they never had Swiggy and Zomato in their life.
Right, yeah. No, I think the point of sleep that you mentioned I think is very critical for every disease that we talk about, because, and that's what we talk in my channel as well, to just keep sticking to the circadian rhythm.
Absolutely, 100%, 100%. And I tell this to everyone, you need a sleep which is adequate, which is peaceful, which is uninterrupted, and which is according to circadian rhythm. This is the most important thing. Our clinical experience also says that most of PCOS patients have high prolactin, they have hypothyroidism. Now, this again proves that it starts from the brain, because all these hormones are released from the anterior pituitary. So how come that every PCOS patients, in fact, 80% of the PCOS patients have associated hypothyroidism? I would say 50% of them have high hyperprolactinemia. So that means there's something going wrong there, which is making them prone to this. So my theory says that it starts from the stress and lack of sleep, and of course coupled with other things, bad diet and lack of exercise and all that. They contribute. Right. But I'm sure the papers would come that it is the stress which actually initiates the pathogenesis of PCOS also.
So I'm going to give you a different picture. You might have heard this, but I'm just going to tell you from my experience, where I think PCOS is also starting from the gut.
Quite possible. Quite possible. I would really love to know your perspective on this.
I'll tell you why. Because all the symptoms, that's why we started with PCOS is not a disease. It's a syndrome.
Yeah.
It's where the underlying problem might not be the ovary per se, it is just the hormonal issue.
Yeah, it is the poor ovary which is finally bearing the brunt
Yeah.
of everything.
So each and every risk factor, we're going to go one by one, okay, and then see how that can be connected. So you said stress, right? So in my experience, what we have seen is, you have the gut bacteria throughout, and whenever there is a disturbance in the gut bacteria, you have this increased intestinal permeability, where there is more influx of bacteria from the intestine into the blood. Those bacteria are not supposed to be there in the blood, it's supposed to be there in the intestine. When we did animal studies, it's very clear that stress disrupts this barrier.
Oh, there we have it.
Right. So the cells kind of like divide apart, and there is increased intestinal permeability. So once it goes over there, then your inflammation starts. So once inflammation starts, then your insulin is not able to reach to the cells, then your insulin is high, then it is connected to all the other hormones. So it is not like we cannot be that unfortunate to have so many diseases at the same time.
It's like I always, think, we were supposed to be healthy by design. How come God has made such a faulty machine? I mean, that you need to, do this, and then only you'll be healthy. I don't, of course, it's good to exercise. I exercise myself. I eat healthy and everything. But somehow, as a whole, this machinery was pretty much sufficient, to handle a lot of things, unless and until we are grossly wrong. So, in case we are not healthy, that means there is something
Something wrong. Right. Of
which
course.
has been done.
Of course. So when one of the most common problem of PCOS is infertility, because the ovum is not being released, there is no fertilization. So people go through infertility. I wanted to ask you a practical question where we say that, decrease the stress, sleep more and everything. That's the underlying treatment. But while they are going through this process, it is a very stressful process.
Very stressful.
Very stressful process.
Very stressful.
In your experience, as a physician, we are recommending sleep and decreasing stress. But as a patient, how are they managing and how do you guide them?
It's actually very unfortunate in the sense that, in my OPD also, I spend 15, 20 minutes, sometimes 30 minutes explaining them how does it happen. And in the end, then, they say, doctor, aap koi dawai de dijiye. And then you feel, oh my God, I spent 30 minutes explaining them what it is. So I guess, probably they are trying at their own end, I mean, you also would agree that weight is a very big problem, it's like, it's not easy, for many people. It's very easy for me to say, okay, reduce stress. But what is it which is going on in your life which is making the stress to happen? It could be financial, it could be your career, it could be relationship or whatever. There could be multiple reasons. So it's very easy for us as a physician also to say, okay, reduce stress, do this, do this, do this. But in the end, people want a solution, what is to be done in case I'm not conceiving now, what is to be done? Let's, right now talk about infertility. PCOS has got many other problems, acne, hair fall, all those things. But infertility, people are really desperate. So it has to be a multidisciplinary approach where on one side we are telling them, okay, you need to be taking care of your lifestyle. And of course, as doctors, we are there to help them. There are various medical protocols these days, ovulation inductions and IUIs and IVF and now egg freezing. A lot of things are coming up. So I think in today's world, both the things need to go side by side. And fertility is not the final goal. Ultimately, you need to be healthy to look after the child who's going to come. So even if you've conceived by hook or crook, but you need to be healthy enough to be looking after the child. So I think both the things have to go hand in hand. And the same thing applies for every other problem of PCOS like acne, hair fall. Today you've rectified acne by all kind of fancy dermatology treatment. But in case you have not really worked at the root cause of it, the thing is going to come back again. So,
Acne is because of elevated androgens.
yes.
Mm.
So most of the PCOS patients actually suffer from hyperandrogenism. So which is they get acne, which is this is a cystic, bad, painful acne, which typically happens on the jawline. They are typically more hairy, and that too at wrong places. Like men, they have hair
Hair.
on the face,
Correct.
and so basically these women, they tend to get hair at at the places where men have hair. So men typically have less hair on the scalp and more hair on the body. So these women complain of scalp hair loss, more hair on the body, more acne,
Mustache and
mustache, yeah,
hirsutism.
hirsutism. So they have hair on the upper lip, on the chin, even medically there's a grading system for the hirsutism. We have something known as Perryman Galloway score, where you can actually give a score that how bad the hirsutism is. It depends upon what is the level of the androgens. Now, hyperandrogenism, other than PCOS, could be because of various other actually
Actually,
pathological
yes.
reasons
Yes.
also, like adrenal causes and other things. But in today's times, the most common reason for all this is PCOS. So the first thing which we have to investigate, in fact, most of our patients are actually referred to us by the dermatologist. Somebody's having acne, somebody's having hair
Hair fall.
fall. So once they haven't found a cause, they come to us, and most of the times we invariably find an underlying PCOS. And also, I would want to say that PCOS is not just the PCOS. In fact, many times on the ultrasounds, the ovaries are actually normal size ovary. So it's actually the insulin resistance. PCOS is actually one manifestation of insulin resistance. PCOS is actually just the tip of iceberg for which the patients come to a doctor. But actually, there is so much which is happening in their bodies which probably will manifest little later, like obesity, truncal obesity. There's a whole metabolic syndrome, which we all know, diabetes, high
Right.
blood pressure,
Correct.
everything.
Correct. Do you see increase in belly fat as well?
Absolutely. As Indians, we all have, we all are pre diabetic, and we all know this. So we need to be even more careful. If you see, people who are thin also have some bit of belly fat, right? So there's a term called, I think, TOFI. It's like thin
Yes.
outside, fat
Fat on the
inside.
inside.
So it's,
Correct.
even if people who are thin, I mean, even I have to make sure, this fat doesn't come in. So it's like we are genetically programmed to have that mesenteric fat inside. So we all have to be very careful. And of course, I mean, you've done so much of work on the insulin resistance, that what is it which causes insulin resistance in the first place? As doctors, I've seen people go to an endocrinologist, they say, oh, you have insulin resistance, you take metformin. But why the hell is insulin resistance happening? Nobody's talking about that. It's very easy to just put them on a contraceptive pill, or maybe just put them on a metformin or whatever. But will this solve the problem? No. I've seen so many times, Dr. Paul, this is so very unnerving. A 14-year-old girl is being put on an oral contraceptive pill. That's bad. That's bad medicine. I mean,
What is the age group that you see PCOS usually in your practice?
so theoretically also, PCOS can start even before the onset of menarche, and it can go on till the menopause goes in. So, because we need to understand, it's not just the PCOS. The problem is insulin resistance.
So delaying menarche as well as a sign of insulin resistance.
Yes. In case a girl is amenorrheic, let's say 16 or 18 years, probably, she could be suffering from some kind of a hormonal imbalance, because of which the first period, which was supposed to be coming, has not come until now.
Early puberty is a sign of insulin.
So we can have various
Both
things. We can
sides,
have early puberty also. We can have late puberty also. I mean, just 2 days back, I mean, it was so funny. There's a mother who comes to me with a daughter who's 120 kgs. And she's saying, oh, my daughter is thoda sa healthy. And my response was, nahi thoda healthy, nahi totally unhealthy. I don't know whether I should have said that or not. But then, as doctors also, we feel desperate. How do we make people understand that they need to take control of their lives? to make sure. I mean, everything is not a doctor's responsibility. You need to be doing your own bit to make sure that things happen properly.
Uh-huh. So,
So,
early, one of the doctor that I talked to, they said that previously they used to see early puberty around like 11, 12. Now they are seeing around
yeah, very
8, 9.
common. 8 years. I mean, this is like very, very disturbing because at 8 years, the girl is not mentally or emotionally mature to understand the implications of having a period. So, and also there's a medical problem, when the periods they start, they basically signal the closure of epiphysis. So the growth
The
or the
growth.
height also could remain stunted.
Uh,
So, I always ask my patients, especially their mothers, आपकी daughter पढ़ने से ज़्यादा खेलती है कि नहीं खेलती है? So, as mothers, it's very important for us to make sure that our daughters actually play. Are they going out 1 hour or 2 hours to play? That will let the happy hormones flow. That will make sure that, their muscles, joints, insulin, every damn thing is working properly. So,
the when childhood obesity is related to early puberty.
absolutely, 100%, 100%. Early childhood obesity is related to PCOS and, of course, early menarche. Yes, absolutely.
It's very directly proportional.
100%.
100%. And you are seeing a lot of childhood obesity in your practice?
A lot. Of course, pediatric patients don't come
Come
to
to you.
me.
But after
But
menarche, they might.
yes, yes, yes. Like it's like common in metro cities to see young girls, 14 years old, 15 years old, 100 kg weight, 120. It's like, it's alarming.
It's alarming. So I have been, after talking to so many doctors in the practice, it's very clear that I think everything starts with the diet
Everything starts with diet and movement
and movement.
and happy state of being.
Actually being, in that initial first 10 years, I think one thing has happened more recently, the last 15, 20 years, is high fat diet.
Yep.
High fat diet, right? So in your practice, when you're seeing patients, do you see that they are having increased amount of fats in the early part of
Yeah.
the
Absolutely. Absolutely. I was comparing this with our childhood. We used to get a treat once in 3 months, and that was the samosa at the end of the exams. And today, when I talk to people that how many meals in a month you have, they say practically every second day they go out and eat. I mean, this is not done. And we know, the kind of stuff which is put outside when you go out, eat. Obviously, the processed and packaged food, they're all bad. So people don't have time. And I understand because of their busy schedules, because of, they're working late, they're in hostels. So the problems are also too many, but we need to find out the solutions. Like I said, like I was coming from the airport to Mumbai. Now, in such rains and such a busy city, where would you find a park to go out and exercise? Not many people would be able to afford a gym, right? How does a common person manage this? As together we all need to find out solutions to this. It's not just PCOS, it's a bigger problem. It is affecting you as a doctor, it is affecting a physician or an endocrinologist. All of us are in the same boat where we need to treat these patients. So on a bigger scale, we need to do something to make sure that people actually end up following a healthy lifestyle. कौन सी city में there is a pathway to walk? I don't think so in India we have any, space for people to walk or let alone exercise.
I'm involved in a research with the gut bacteria and PCOS over there, and we have figured out that high fat diet is interfering with the gut barrier, and it increases this bacteria called Bacteroides. Bacteroides is a gram-negative rod and gram-negative anaerobic thing, and then that gram-negative, once it goes inside the blood, your inflammation gets started, right? That is one way of insulin. The second way that high fat diet does is it inhibits the bile acids.
Okay.
And bile acids are necessary to regulate the cholesterol. And bile acids stimulate some IL-22, a inflammatory marker, and that increases the folliculogenesis.
Very much possible.
Right.
Very much
Ah.
possible.
So nowadays the research is thinking along the lines that can we give IL-22 to improve the ovarian folliculogenesis. I am saying that instead of giving IL-22, how about decreasing the fat?
We always love to find out complicated solutions to simple problems. It's a fact.
It's a fact. So the other thing that I think is the high fat diet is not your regular oil. That's not the case. I think it is all the processed foods, ultra processed food that is coming in.
Yeah, yeah, yeah.
And simple thing we can, if it was my family member who's having a PCOS, I think we should just draw a line and then says that no packaged foods at all. And then you have seen people resolving their symptoms.
Absolutely. So, Dr. Paul, I'm myself a yoga person. I'm a certified teacher. So I learned it because yoga helped me a lot, and it's a beautiful form of taking care of your body and mind both. When you do those breathing exercises and when you sit in just quietness, not just, let's not call it even meditation, people find it very difficult. Even that helps you to settle down. So, about 2 years back, we actually did a program of managing PCOS with the yoga program, 3 months, and we got some amazing results. Amazing results. People lost weight, people's inflammatory markers came down. So it was such an eye opener that all this happens at the level of the brain, and of course coupled with the fact that high fat diet and other problems. So like I said, we need to have a multidisciplinary approach where a nutritionist is working, where a GI person is working, maybe a fitness trainer is working, endocrinologist, fertility specialist. And these women are actually struggling. I mean, it's not easy for them. I have seen there are people who are literally struggling. So it's difficult for them also. But today, like I said, not many solutions are easy. Like, I gave you one example of an exercise. How the hell a normal person who can't afford to go to a gym, how does she exercise? She's staying in a hostel. How does she train her hostel chef to make a good diet? She's studying the whole night. She has an exam tomorrow morning or a presentation to make tomorrow morning. How does she manage her life? So it's not easy. Modern life is like, it is not that simple as life was simple for us. But people at least should be made to aware that the solution to PCOS is not a metformin or a contraceptive tablet. If you want to reverse your PCOS, then you need to take control of the entire thing in your hands. So this people need to understand. And of course, as doctors, you and I are there to help them.
Correct, correct. In multiple studies, I also read that weight loss is the treatment, correct?
Absolutely.
Weight loss is the
Weight
treatment.
loss, even 5% of weight loss can bring about changes in all the markers of PCOS.
5% is, let's say, you're 100 kilos. 95 kilos itself.
5% weight loss also can bring about significant change. So every kg will count. So don't get disheartened, oh, it is just 2 kgs or 3 kgs or 5 kgs. Each kg loss is bringing you, back to recovery. And talking about the weight, there is something known as a lean PCOS also. I don't know if you know about this or not.
Yes.
So once again, these are the people who are very thin, but they have, practically all manifestations of PCOS. They might be having acne, they may be having hair fall, they find it difficult to, conceive. So once again, the problem of stress comes in. So in thin PCOS, basically the cause is stress. And secondly, altered fat and muscle ratio in the body. So once again, even you might be thin from outside, but you might be having practically no muscle and lots of fat inside. So
Of
that
course.
concept of TOFI comes in.
Of course.
So once again, even thin people need to exercise. And another problem, which I'm sure you also would have seen, that thin people think, oh, I can eat everything. I can have the burger or the pastry or whatever, not realizing that this is going to cause you as much damage as it would cause to a person who's on the higher BMI side.
Of course. In my experience, I know, including me, I was pretty big before. I was 100 kilos before.
Oh my God. You should tell your story one day on your channel.
Yeah. No, I do. I actually am very open about it that I know I lost 30 kilos with fasting. But during that, I did not exercise. I did not do strength training, that I lost my muscle. So I did an DEXA scan and I found out that even though I'm skinny, I'm fat. So that we belong to the skinny fat category. My body fat percentage was 29. 29. Normal is around like 15 to 17. So I did like a challenge on my channel. For 100 days, I was able to decrease only like 5-6%. 5-6%. I know it was only 24. But I have to put so much effort. It was not easy at all. It
So
was not
that's what I'm
easy.
saying. Thin people actually, I see it amongst the doctors also when we have our parties. People are, gobbling those samosas and
Right.
burgers, thinking, oh, I'm thin, I can't get fat. But without realizing that probably it will cause you a lot of damage. And another thing which, I tell my patients is there's something known as sarcopenia. You also know the muscle loss. So every person from the age of 30 years would probably lose 1% of the muscle mass every year, unless and until we are very proactive about it. We need to get into that muscle building exercise. We need to do strength training. Fortunately, in olden times, there was so much of work in the households that people need to pick up grocery bags or do a lot of stuff at home, that there was an inbuilt strength training. But today, with the modern households, there's practically no work. When people say, housewives come and say, oh ma'am, I'm very very busy. Hey, aap kya karte ho? So I do a little bit of dusting, I do cooking, because the maid cuts the vegetable, I do just a little bit of so I said, where's the physical work? So we all need to understand, as human beings, we were designed to move. We were not designed to be sedentary. We were designed to use our body. I mean, this is an old saying, you use it or you lose it. So
In your practice with PCOS patient, the body fat percentage should be high, right?
absolutely. I mean, you get it done, it's 100%. Even with thin patients,
Thin patient, exactly.
it's like altered
Exactly.
fat and muscle ratio.
So either ways, whether you are on the higher side or in the lean PCOS, body fat percentage, I think I've seen around 35-40%.
I'm sure fatty liver and all that also is the probable genesis is the same, or is it something different?
I'm telling you, everything, I think it is boiling down to that intestinal permeability we talked about. Yeah, no matter, I know I'm repeating the same thing again, but I have a strong feeling it is because that, and the reason for the intestinal permeability is not only the high fat diet, it is also the high carb diet as well. And especially in PCOS, excessive branch chain amino acids, leucine, isoleucine, and valine, is known to cause the intestinal disruption a little bit more.
I was, purposefully not talking about this, thinking that it will become too technical. But I'm glad you started this point.
Yes. No, no,
So
no.
it
This is very,
is,
it's very important. So
Yeah.
for PCOS, what I'm thinking is, okay, so we talked about high fat. So we should decrease the fat content. And excessive protein is an issue, especially in Western countries.
Yes.
Maybe not over here that much, probably.
No, but Dr. Pal, this is the problem. In pregnancy, every patient comes and tells me, Doctor, you don't write a protein powder for me. And I said, you have so much of protein in your diet. Why don't you look inside your kitchen? Do you take a bowl of dal with each meal? Do you take egg whites? Do you take paneer or tofu? Do you do that? Or you are trying to get a shortcut that I just take two, scoops of protein powder? No, this is a big problem. Probably either you don't have time or you find it absolutely uncool to cook or whatever. In fact, I tell this to my son also. Cooking is one skill. It's a life-saving skill, which every person, male or female, must know this. Because otherwise you are dependent upon, other things. And like you rightly said, this was a concept which was brought to me by my yoga teacher, that you don't need so much of proteins, especially the extraneous protein.
Yes, yes.
People who work out, they say, oh, I need a lot of protein. Of course, you need proteins, but you don't really need to pump yourself with protein. So I'm very glad that you spoke about this. In fact, I would really want you to explain this to me more. This is a very new
Yeah, very
concept.
new concept.
And
Very new concept.
excess protein is actually not a great idea.
Especially for PCOS. Especially for
All inflammatory conditions
implementing
in the
condition.
body.
So this branch chain amino acids stimulates this bacteria called Prevotella. Prevotella.
Okay.
Prevotella.
Okay.
This Prevotella is is increased in proportions in the gut, and this invariably affects the insulin resistance by stimulating the mTOR pathway, mammalian rapamycin pathway.
Wow.
So every PCOS problem has a reason behind it.
Yeah.
So high fat diet, as we talked about, it disturbs the bile acid thing. Excessive protein, BCAA, and excessive carb. This is the main problem. Excessive carb is the main problem. And in one of the paper with PCOS, they said artificial sweetness, where saccharin is known to alter the gut bacteria significantly. Whenever the gut bacteria is altered, then the hormonal problem is also coming in. So what I tell my patient with fatty liver who has PCOS as well is that, see, listen, you have an issue. So you need to be conscious and then need to be really proactive and put your foot down and then say that I'm going to do this.
Absolutely.
I'm going to do this. If not, this is just a vicious cycle that you're not going to come out of it at all. So I say decrease fat, decrease carb, and normal protein in PCOS.
Yes, normal protein.
Normal protein in PCOS. On the top of it, you exactly mentioned about decreasing the stress by using some kind of relaxation techniques. Yoga has been shown to improve PCOS, similar to Avya. And then sleep is one of the main things.
Primary things.
We did there was a study on mice. They gave light to the mice overnight. And this hormonal imbalance that you're talking about happened in 28 days.
Yeah. So there was a study which says that in case you are deficient in your sleep for 2 hours between 10 to 4 window, which is 10 p.m. to 4 a.m. window, 25 days in a year. If you have deficiency of 2 hours of sleep between 10 p.m. to 4 a.m., 25 days only in a year, it classifies you as shift worker and puts you at the risk of all metabolic consequences which a shift worker has. Now, just think of it. It's like only 25 days in a year. In case you're not sleeping, if you're sleeping at 12 o'clock, the damage is done.
Damage is done, yeah. I mean, then it comes back to the brain axis that we're talking about.
Yeah.
The low carb diet, is that you recommend in your practice?
So I, Dr. Pal, tell people to follow the natural Indian diet. This is what we've been also talking in our challenge is, for me, for an Indian diet, it's very difficult to say what is low carb and what is high carb. I mean, with a roti and a chawal, can you do that? It's very difficult. So I tell people that every meal of your day should have one cereal, not the American cereal, Indian cereal,
Grain cereal,
one lentil, one fruit, and one vegetable. If you do this, by and large, you are sorted. And all that should be seasonal and local food. I mean, it should not be, expensive like avocados or blueberries, which you don't get in India. What does an Indian person eat? So if you have a roti, sabji, dal, and a fruit, by and large, this is complete. This is my simple funda, which I tell to all my patients. And I've seen this. Roti, sabji kha ke koi mota nahi hota hai. No, it's a fact. Unless and until you're stuffing yourself with 5, 6, 7 rotis. Otherwise, with a normal bland roti, how can somebody get fat?
So, in what I tell my patients is that in the first 3 months. So let's say you are PCOS patient or fatty liver patient comes into me. We know that it's insulin resistance. The first 3 months, you have to put that extra effort by calculating the number of carbs per day, see how much you are doing, and try to decrease the carbs.
How do you do that?
So
Let's
what?
say for an Indian, how will you do that?
So we have diet charts and everything, right? So I say that first thing I tell them to measure, get a weighing scale, not your weighing scale, the food weighing scale, a small food weighing scale, and then I don't ask them to change anything, doctor. I don't ask them to change anything. The first 1 week, I ask them to just write what they are eating per day. That's it.
Wow.
So if you're eating chawal, you need to know how much chawal that you're eating. So you take a small bowl and the exact amount of chawal that you're eating, just put it on the weighing scale. So they will say, okay, 100 grams of carbs. They take a picture, they send it to me. And then and then they will send the sabji, the vegetables, fruits and everything, right? So in the whole day, they are not even eating unhealthy. They're eating healthy. In the healthy part itself, the carbohydrate content is 300 grams per day. 300 grams per day. And studies have shown that insulin resistance will not be able to handle 300 grams of carbs per day. So it needs to be somewhere around 150 or something like that.
How much does one roti has? How many carbs
So
does it have?
So
A normal average Indian
average
roti?
size roti, they say depending on the size of the roti. So you'll be surprised that let's say a roti will be around 8 to 10 grams of carbs based on if it is small size. It can actually go up to 15 to 20. 15 to 20. So for example, I'm from South, I eat dosa, right? So one dosa is easily 18 to 20 grams of carbs.
Okay. Even though it is made with rice and dal.
Yes, exactly.
Wow.
Exactly. That is the problem. Indian food is very healthy. Extremely
very
healthy.
healthy,
Very
actually.
healthy. If there is no mix of adulteration with processed foods, packaged foods, Western foods, if you're eating only Indian foods right from the start, I don't think they will end up with PCO to start with.
Exactly.
But when there is an adulterated, contaminated food with processed and packaged, then the Indian food efficacy doesn't work.
Yeah.
Doesn't work at all.
Yeah.
So I am damn sure is that if the PCOS patient can go down on the carbs as low as 100 grams of carbs per day or even lower, and they can continue and sustain it for like 6 months to a year, we can close all the IVF centers.
100%. You tell a person to lose weight, she will start spontaneous ovulations.
Yes.
So many times, Dr. Pal, it's so common that IVF also fails. 3 cycles IVF ho gaya, it fails. And then after weight loss, she spontaneously conceives. So that means inherently inside there was no problem. Once that, that hormonal imbalance has been rectified, the ovulations happen spontaneously and people conceive spontaneously. It's so very common. It's just that, how come only in metros people are facing the problem of infertility? Why in villages or why in olden times our mothers or grandmothers never suffered from
All these
infertility?
issues. Yeah.
So the ovaries were nicely ovulating and they were happy.
So let's say
Probably
I
there
have.
was no processed food and no stress and
Of course.
I mean, we were playing a lot. I remember my mother had to pull me from the park to get into the house and then sleep by 10 o'clock and up by 5 o'clock. That was the norm in our days.
So you will say simple measures will actually, going back to simple measures will help.
100%, 200%. 200%. But yes, in case you are not able to do all that because of XYZ reason, then of course you need to take help. I mean, it's not like, you're getting diabetes, you're getting high cholesterol and still you're sitting at home, nahi, I will do it like this. You have to, you have to go to the doctor and follow both the paths.
All along with it. All along. So in your practice, how many patients are actually being referred to infertility centers? Very common?
Very common.
Very common.
Very common. In fact, the statistics, I think, say the incidence of any kind of infertility is about 17 to 18%. This is the quoted incidence. And so, what is infertility? Infertility is when a couple is not able to get pregnant after 1 year of unprotected intercourse. That is another problem that today, after 2 or 3 months, people come to us. It's like, कि pehle 4 5 years I'm not going to do it, but the day I've decided next month it better happens. Now, if this has not happened, I must go to the doctor. So that's also another problem. And if I tell people, no, you must wait, they say, no, doctor, I'm turning 35. I say, suddenly you've not turned 35. You would have thought about it before. So it's like people are having, a sword hanging on their heads that today I've turned 35. Now I better get pregnant. 1 month ho gaya, and now something has to be done. So
So
it's
it has to be 1 year.
1 year.
1 year
One
of
year. The book
attempt.
says 1 year of unprotected intercourse in case the pregnancy doesn't happen.
Then you
Now
belong
is
to
the
it.
time to investigate. But people come to us much, much, much before that. 1 month, 2 months, and they are at the doctor's
Or
chamber.
doctor chamber.
It's okay, but nowadays we say post 35, you should not be waiting for very long, because as it is, the ovarian reserve also comes down.
What is the ideal time to be pregnant according to you?
Ha ha ha. This is, if I say this, people will go into a shock.
As a
As
gynecologist, what is the ideal time to get
early
pregnant?
20s.
Early 20s.
Early 20s. That's when a girl gets pregnant easily, has an easy pregnancy, uncomplicated pregnancy with the most successful pregnancy outcomes. But today, because of various reasons, career and not being able to find the right partner, people are getting married beyond 30s. And then after that, you're waiting 3 4 years to plan a pregnancy. And then suddenly at 35, you wake, oh, I have turned 35.
Right.
So,
The 35 is because pregnancy beyond 35 has an increased risk of complications, correct? Or not really?
number one is that chances of getting pregnant easily, that decreases. So we have proper statistics which say that age is one single most important variable when it comes to getting pregnant. So there's an exponential decline with rising age. So it's not 35, 34, 33, whatever. The age is one single important variable. And today we are seeing a very disturbing phenomena which is called premature ovarian failure. So women are losing their eggs faster. So there are so many times people come to us with a missed period, and you get their pregnancy test done, it's negative. You get their AMH and FSH done, it's high. AMH is low and FSH is high. It's so
At what
disappointing.
age?
32, 33.
Oh my God.
I mean, I had a few days back a patient who was a VP in one of the corporates. She says, now I'm settled in my career and now I want to plan a pregnancy. And she came to us with a missed period. We did a pregnancy test. It was negative. We did the complete hormonal profile and we found out that AMH was just zero. 0.1, which is like
Almost a
practically
failure.
almost, this is known as premature
Ovarian
ovarian
failure.
or we don't like to use the word failure. We say as doctors, ovarian insufficiency.
Insufficiency. Yeah, exactly.
So,
Insufficiency.
yeah. So, number one, ovarian reserve is a genetic,
Can you tell us about the ovarian reserve?
Okay. So every girl child is born with fixed number of eggs in her ovary. Now this is controlled genetically. That's why in olden times the age of menopause was decided by, for example, if your mother had an early menopause, probably you will also have an early menopause. If your mother had late, you probably also will have a late menopause. Now when a girl child is born, she probably has millions of eggs in her ovary. But then slowly and slowly, the eggs, they come down. By the time she has her puberty, probably the eggs in her ovary are only 3 lakhs. For millions, it comes like that. And when she is, planning her pregnancy by about 25 or whatever, the eggs probably could have been just 40,000 or 50,000. So the age causes, exponential decline. And
So for
also,
every year, there's decline in the ovum.
and also, every month, if there's one egg ovulating, there are 10 eggs which are developing at the same time, but out of that, only one lucky egg develops and ovulates. So there's a lot of egg wastage which happens every cycle. And nowadays, because of multiple environmental factors like pollution in the air, herbicides, pesticides, bad food, women are losing, smoking, alcohol, women are losing their eggs very fast. I mean, it's very common, very common. And that's why, these days we talk about egg freezing. We tell people that in case, because of whatever reason, you are planning to delay your pregnancy, at least go to the doctor. When you are in 25, you're 25 or 26, get your AMH test done, get your eggs frozen, so that later on, you may plan 35, 40, whatever. At least you have some backup.
Because the quality of the egg is much better.
Yes. So people generally ask, ma'am, when? Should I do it at 25? So the answer to that is earlier the better. Because earlier we get a better cohort of eggs, better number, better quality.
And how long
So this is the new gynecology. Like I was telling you, in olden times, we never faced this problem. Infertility, premature ovarian insufficiency was not there.
So as I'm just going to summarize what you said. As the age advances, the number of ovarian follicles can also go down. Number of ovum goes down. So you're saying that earlier, the better chance of pregnancy. Chance of pregnancy. But if you're delaying because of your career growth or any other reasons, they call it as cryopreservation? Or what do they?
Yeah, so it's called oocyte freezing.
Oocyte freezing.
Yeah,
oocyte is the
oocyte
ovum.
freezing is more technical, but egg freezing is
Egg freezing.
a common laymanish.
Huh.
Nowadays, we also do what is known as embryo freezing. So, in case you know that this is the partner, and as a couple you want to delay your pregnancy, then you can get your embryo frozen. And embryo frozen, pregnancy after frozen embryos is much better than oocyte freezing, because many oocytes might not get fertilized. So here you've already made the embryo and frozen it. So that carries better pregnancy rates.
As the years advance, is the prognosis of that embryo turning into a successful pregnancy? What is the prognosis? Is it good?
Not really. The eggs and the embryo can be stored till infinity. Till infinity. So that's what is the future artificial reproductive technology, and it has its own ethical and emotional dilemmas. God forbid the parents are not there and the embryo is still live.
Right.
So a lot of legal and ethical and emotional problems are there. So
the frozen embryos can survive until infinity. But let's say we unfreeze it, we thaw it, and then implant
there
it.
is always a wastage. When you thaw them, in case there's any problem in the thawing, or even a minor variation here and there, it can
That's what I was
spoil
trying-
the embryos.
But
we assume that the IVF centers
Or
are
doing a good
doing
job.
a good job.
Good job. So the successful pregnancy is definitely a possibility.
Absolutely, absolutely.
You have seen
So people do go for, the couples nowadays go for the embryo freezing, and
I'm going to ask you a very practical question. This is all new, right? New techniques.
Yeah.
How do we know the increased risk of, chromosomal abnormality?
Yeah. So whatever the data says till now, whatever babies have been born through the FET, which is the frozen embryo transfer, we've not seen any statistical difference in the chromosomal or any kind of birth anomalies in these babies. But like you rightly said, time will tell a lot of things.
Because it's all new.
Yeah, it's all new. But
so far the data is good.
So far the data seems very promising. So I always tell this to patients, that in case you are planning your pregnancy to be little later, at least go to the doctor, discuss your options, and see where do you stand today. For example, if your AMH today is very low and you are just 27 or 28, better go for egg freezing quickly. In case your AMH is still okay, you can still take some time.
AMH is a testing that they can come and check with you.
Yes. So AMH is a very simple blood test. It's called anti-Mullerian hormone. So it's a marker for testing your ovarian reserve.
So let's say I am a 30-year-old female. I have finished my master's. I'm doing my software engineering, and I want to grow in my career. I have not find the right partner yet. But at the same time, I'm reading about getting pregnant after 30, 35. There's increased risk of complications. I don't want to do it. Based on this discussion, maybe it is time to consider your oocyte egg freezing. How do they do it?
So most important is, I would say, please go to a gynecologist, meet, talk about your concerns with the gynecologist. Now the gynecologist, based on your history, your family history, your own medical history, will advise you all the tests to find out, what is your overall medical condition. Supposing you're a diabetic, supposing you're obese, supposing you better control all these things before you start to become pregnant. So first of all, pay a visit to a doctor and get yourself thoroughly examined and investigated. So nowadays we have we spoke about a test called AMH. It's called anti-Mullerian hormone. So it's a very easy way to find out your ovarian reserve. Of course, there are other tests also, like we can do a FSH on day 2 of the cycle. We can do an ultrasound on 3rd day of the cycle to find out what is known as the AFC, antral follicle count. So it's the budding follicles in an ovary. We can actually measure them on the ultrasound to see how much of egg reserve do you have. Now, supposing if you have good reserve.
Is there a number to it?
Yeah. So generally, on an average, we see about 7 to 8 good antral follicles each side ovary per cycle. Right? But PCOS, this number could go up to 15, 20, 25.
But nothing will work.
But none of these follicles are good enough to finally develop into a dominant follicle and finally ovulate. So this is what is PCOS. So number 1 is meet a doctor, get these basic tests done. And in case you feel that the pregnancy is quite a time away, then do discuss with your doctor the option of egg freezing. So egg freezing nowadays, with the modern ART, coming in, it's a very simple thing. We give certain medicines to stimulate the ovary so that we have multiple eggs which are developing in a cycle. And then when the time comes, when these eggs are mature, there's a very small procedure by which we aspirate these eggs and immediately they are frozen. It's as simple as
through the vagina uterus.
Yes. So through the vagina, through the ultrasound guided, we just aspirate those eggs and we freeze them. It's as simple as that. Now,
how many eggs do you freeze?
Yeah. So that's another thing. Now, it again depends upon your ovarian reserve. In one cycle, we might just get 15 eggs or maybe just good 5 or 6 eggs. On an average, most of the IVF specialists, they agree on this, that we should have at least 10 to 15 eggs, good quality eggs with us, so that we can have some decent carry home baby rate. So there is something called as the pregnancy rate, then there is carry home baby rate. So we should have at least 15 eggs in our kitty to freeze. Now, some women may require 1 cycle or 2 cycle or 3 cycles of stimulation to get us that number. So nowadays we have another thing which is coming up, which is called embryo freezing. So what happens there is, in case a woman is already married or she is in a committed relationship and she knows for sure that this is the partner, final partner, we can take the egg from the mother, the sperm from the father, we fertilize them in the laboratory, and when the embryo is made, we freeze the embryo. And we can get 2 or 3 embryos frozen. So embryo freezing always gives us better pregnancy rates as compared to egg freezing, because many of the eggs which we have frozen may not finally end up fertilizing. So in case you are sure, but all these things,
what is the probability success of oocyte developing into an embryo? Frozen egg converting into an embryo when at the time of the need, let's say
it's very difficult.
Like 40-50%?
I would say, yeah.
50%.
This is the
But definitely not
average
100%.
Not 100%,
not 100%.
because it all depends also upon the quality of the egg and also the quality of the sperm later on.
Nobody talks about that.
Yeah, nobody talks about that.
Quality.
We Indians always love to not talk about
right? Not talking about
Yeah,
sperm at
yeah.
all in your practice.
Yes, even till today, after 1 year of investigation, after multiple probing, husband ने टेस्ट कराया, नहीं नहीं अभी उनको टाइम नहीं मिला, तो ऐसे अच्छा ओके, it's a very
But
common thing.
but the etiology of the infertility could be from the man's side as well.
Yes. So, in fact, it is said that 40% the cause is a female infertility, 40% male infertility, 40%, 10% both, 10% no cause found, idiopathic infertility. So, men are an equal culprit when it comes to producing a
Sometimes more.
baby.
So for men,
So,
it's the sperm count.
yeah, sperm count, the motility of the sperms, and also the appearance of the sperm, the morphology of the sperms. Many times the sperm could be having multiple defects at the head, tail. So when we do a semen analysis, there are properly defined WHO parameters. So when we issue a semen analysis report, all this is taken out. Of course, nowadays we have more advanced tests. There's something known as DFI, DNA fragmentation index. So higher the DFI goes, that means the more is the damage which is happening to the sperms.
Wow.
Smoking is a big
Smoking is a big
culprit.
thing.
Big,
Exactly.
big culprit.
Smoking in women as well.
Absolutely, smoking is one of the major reasons for the premature ovarian insufficiency. Major reason. And that's another problem today. I mean,
In
it's
your practice, are you seeing women smoking?
a lot.
A lot.
A lot.
That's not the case before.
It was not the case before, but today a lot of people do a lot of things to look and feel cool.
Huh. Is it vaping or smoking?
Both.
Both.
It's actually very sad. Alcohol, we still understand. I still can't understand the psychology of a person who's smoking. What is it which gives you a high, knowing fully well that smoking affects every cell in the body,
yeah.
every cell in the
Every
body,
cell in the
top to bottom.
So I tell my patient is that, if you want to quit smoking or alcohol, if you want to quit only one, quit smoking.
Yes,
Quit
absolutely.
smoking.
Smoking has a direct, I mean, it causes such a high free radical
Damage, yes, of course. And smoking decreases the sperm count and motility as well.
100%. Like, no doubt on
Yeah,
this.
and then ED, erectile dysfunction, is one of the most common side effects of smoking.
Yeah. I mean, again, people don't talk about ED. I mean, it's such a common problem. I mean, we investigate, kahin pe we don't find any cause, and then little bit, somebody say, oh, this is a problem, and then you go in a different direction.
But that should be the first thing.
That should be the first thing. But people don't talk about this. So, I'm happy, at least with the internet coming in, your platform, my platform. We encourage people to talk about, let's be open. I mean, there's nothing wrong.
Nothing wrong with it at all.
Nothing wrong.
Any infertility discussion should be both husband and wife.
Absolutely. But people don't come to us.
They don't come to you?
It's so strange, Dr. Paul. Just 2 days back, yesterday. So I was asking, I had 3 people in my OPD, husband, wife, and the mother-in-law, the sasuma, right? And then, my standard question
Mother-in-law
is...
of the husband?
No, the
Of the
husband's mom.
husband's mom,
right?
yeah.
So my standard question, I take a detailed history and I ask, does any one of you smoke? Then immediately the mother-in-law pops in, oh, my son smokes, he has a lot of pressure and stress in his life. He works in IT, doctor. I hope you understand. I said, oh my God. I mean, this is like, as if the mother's trying to justify why does my son smokes. Now just think of the psychology. And I said, Mom, at least on this, you should not be taking your son's side. And you're trying to justify. I mean, you don't even know what kind of stress do as we work as doctors. Your son works in an IT department. You're saying, oh, he has a lot of stress. And that's why he smokes.
Wow. Wow.
So we have multiple types of problems when it comes to us as doctors.
You would see so many things, right? So many things. I remember when I was in OBGYN rotation, when we're dealing with the infertility, the family invariably creates a victim card for the women.
Yeah.
Is that still happening? Or?
See here, in case, just think of it, Dr. Pal, in case the woman said, I'm smoking, what response would a sasu mama would have?
No, then the son will start smoking because, because that's too much stress. Oh my God.
So it's a very it's very difficult to understand the psychology of people. I mean, I still fail to understand the psychology of a person who's in the first place smoking. I know there's another person who is his mom trying to justify why is he smoking, and the poor woman who is being affected the most is keeping quiet, not able to say anything. That's the plight of today modern woman who is even educated. It's so
It's
sad.
so very sad.
So
Very
very
sad.
sad.
So very sad. Family support is one of the main things that you.
Very, yeah.
We talked about the
Yeah.
stress and the emotional component.
Yeah.
Uh,
So, abnormal semen parameters not only can cause infertility, it can cause abortions, it can cause birth defects, it can cause multiple problems.
the carry home birth rate.
Yeah,
I want you to educate the audience. There's a very slight nuance over there because every pregnancy is not a successful delivery.
absolutely. Carry home baby rate. At home, you carry a baby. So that is very different from just getting pregnant.
Pregnant.
Yeah. So in fact, the abortion rates could be as high as 10 to 15%. So 10 to 15% pregnancies may get lost. Now, to you, it may seem such a big number, but a lot of pregnancies end up in abortion, especially in the first trimester, in case there is something wrong with the pregnancy. It's a nature's rule. The nature would never want an abnormal embryo to develop. So the nature aborts the pregnancy. Now, we've seen women who are, couples who are smoking. The abortion rates could be much higher. So, yes, of course, there is a difference between getting pregnant and then finally taking your baby back home.
Back home. And that is why in I think I've read somewhere that the environment where the embryo is being formed is extremely important, which means the women should be healthier at the time of conception to get a successful outcome.
Absolutely. That's why I said, in case you are not planning to get pregnant in your future, at least use this time to make sure that your body is healthy. Keep working on yourself so that when you finally make a decision of becoming pregnant, your BMI is in order, your sugars, your blood pressure, your every parameter is in place.
In place. So moving from the pregnancy and the part from 20 to 40, the most important thing that I get questions on is the menopausal period between around 45 to 55. What is the common menopausal age these days?
Okay, so here, once again, the menopause is not a definite thing, is not a fixed thing for every woman. Any woman who gets a menopause earlier than 40 years, we again say it's premature menopause. And any menopause which happens after 40 years is supposed to be a normal thing. But it all depends upon your genetic makeup. Some women might get a menopause at 42, while another woman might go up to 58 also. It depends upon your ovarian reserve and how well are you taking care of your eggs, which means once again, eating good food, making sure that you're not suffering from any lifestyle diseases. There are few things which are beyond our control. Somebody's diagnosed with a malignancy, and this is something which is beyond anybody's, by and large, control. But it's important to look after yourself. And I also said that women are these days losing their eggs faster because of multiple environmental factors all around us. Now, if there's pollution, you can't help it. I mean, you have to breathe in that air. Can't help it. If there's a vegetable coming to you, however much you wash it, you can't be really sure that
Correct.
it is completely free
Correct.
from the pesticide or the herbicide.
You can do whatever you can from your side.
Yeah, but there are a lot of factors which are beyond your control. I mean, you can control your smoking, alcohol, making sure that your diet by and large is good, taking care of your stress factors, but still there would be some factors. So, menopause, I tell people, is that number one, never get scared. I mean, it's a natural transition of your age, and I take it like this: it's a wonderful phase. You should celebrate the kind of wisdom you have acquired for so many years, and the very fact that you raised a family, you've brought up your children, you've come this far with a single or a multiple partners or whatever. But it's a time to take pride and look back. So never get scared. But this is the time when women should be even more careful of their health. The biggest thing which a woman faces actually are two things. One is the risk of osteoporosis, and second is a cardiovascular risk. So the estrogen is a hormone which protects your heart and it protects your bone. So strength training is once again a very, very important thing for every woman. Number
Strength
one,
training increases estrogen, helps in strength training.
no, 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 no. Once you go into menopause, you need to be strengthening your bones because now there
There
is
is no
no
estrogen.
estrogen to protect your
Protect the
bone. And of
bones.
course, when you do a good strength training, you have good muscles, you have good, joints, your heart is good. So you benefit everywhere. So I always tell this to my patients that, it's important for a woman in 45 age group to exercise more than a woman when she is 25. Of course, every woman must exercise. But now you need to be even more proactive. Make sure that your diet has vitamin D, has calcium, and make sure that you have less inflammation in the body by reducing your stress, reducing your cortisol. We know inflammation or high cortisol can cause bone loss. So there's everything is interconnected. And once again, it comes to move your body, eat little less, and be happy.
So you recommend more strength training around the age of 45 when they have menopause.
Absolutely. And Dr. Paul, I started strength training 10 years back. Like I'm now nearing 60 and I
You're
will
60.
be,
You don't look like you're 60. You look so young.
I'm nearing 60. But it's been, for me, the menopause has been the best phase of my life. I've done the best in my life after my menopause. I've been at the best stage of my fitness after my menopause. So, and I'm not just saying it, I wish some people get motivated by listening to this, that never give an excuse that why can't I do this? I mean, all of us have our own excuses. As doctors also, we're working late, this, that, but never give an excuse, because when you give an excuse, you're actually fooling yourself, because your health is your responsibility. It's nobody else's.
Of course. What kind of strength training that you do?
So I do it with weights,
Weights.
bands.
Bands.
Yeah. So I'm a yoga teacher. So I do practice 4 days yoga and I do 3 days of strength training too. So I practice. I miss only if I'm stuck up in a hospital.
Oh my God. So you are a busy surgeon, busy OBGYN, clinical practice. You are active in YouTube, social media, and you find time to do strength training.
No, this is like an attempt to make sure that my body is in place. and I think every woman must realize this, that you need to do it for yourself. I mean, in my family, everybody knows that 1 hour, they can't disturb me. I mean, I've set those boundaries that you need to do this. And for every woman who's watching this, they must be selfish when it comes to their self-care. It's very important. Very, very important. And why not? I mean, why a man can go to exercise? Why can't a woman do this?
Of course. Of course. And they are working a lot more with
Yes,
the family.
absolutely. So it's very, very important. And like I said, eat simple, eat less.
You don't need that much. You don't need, your body doesn't need that much.
Exactly. And unfortunately, we all eat much more than what we are supposed to eat. Then on top of that, we eat wrong things. Then on top of that, we eat at wrong times. So फिर बेचारी body क्या करेगी? The body is going to collapse.
So, I mean, you are doing yoga, you're doing strength training, you look much younger than your age, for sure, of course. That is the living testimonial that, people can follow you And then, have a very good menopausal life.
Yeah. So I would say, fortunately or unfortunately, I had an early menopause when I was 41. So it's been now 17, 18 years, and I've been surviving.
Yeah. What the hot flashes that comes around menopause, right? Is it a common thing that affects everybody?
It does. So it's, once again, it's not, I would say, it's not a very uniform thing that every woman will have hot flashes. It varies from person to person. And why does that happen? Is because the lower estrogen levels somehow disturb the thermostat which is present in our
I see.
hypothalamus.
Thermoregulation.
Yeah. So for some people, it could be, really bad that they are not able to work and they're constantly with the fan. And, there is something known as a night sweats. So, people wake up in the middle of the night. So,
Just sweating.
yeah, just
I had a
sweating.
patient, she has to remove the whole
Yeah.
t-shirt
Yeah.
because she just completely
Yeah.
sweat.
So, some people have it more, some people have it less. But I would say, I always tell my people, my patients, is that first of all, don't get worried. Nobody dies because of a hot flash. So don't get worried. Oh, doctor, this is, I understand it's a problem. But typically, we've seen within 2-3 years of starting the menopause, now the body gets used to lower levels of estrogen and sort of makes peace with it. कि अब यही है, अब I can't get more estrogen than this, let me be happy with it. So till that time, do whatever makes you comfortable. It could be wearing your clothes in layers and making sure that you exercise, follow a good diet. And in case nothing works, there is a small subset of people wherein we might need to put them on HRT for some time. There are proper guidelines for putting a patient on HRT. So,
Hormone replacement therapy.
yeah, hormone replacement therapy. So, there are proper guidelines like who should be put on. So,
So doctor will decide.
yeah, let the doctor decide. Please don't ever take a medicine just because my friend is taking or my sister is taking. HRT comes with its own risks, including risks for the endometrial and the breast cancers. So it is a decision which you must take after talking with your doctor.
Is HRT available in the pharmacy that anybody can buy here in India?
Unfortunately, in India, in case you have your friend's prescription with you, you can take your friend's prescription and buy an HRT.
HRT.
So
Same
which
dosage.
is sad. So here, you have your friendly chemist and a friendly pharmacist who is ready to oblige you.
Wow. Because it causes blood clots sometimes, right?
Yes, of course. So that's why I said there are the decision for HRT has to be taken after a detailed discussion with your doctor, because the doctor is going to evaluate your medical condition. If you're obese, if you're a smoker, if you're a diabetic, if you're at a risk of any form of DVT,
Correct,
of course,
blood clot
that may not be a good option for you.
Exactly.
So there are multiple things which can be done, for hot flashes. And in case nothing works, HRT is there. We can put you on guided HRT with a proper monitoring. This is very important. So don't just take an HRT because somebody else takes this pill.
On your
So
own. Yeah,
never
on your
do
own.
that.
The other problem in this menopausal group is the osteoporosis. And you said that estrogen is the key thing to maintain the muscle mass and bone and everything. And since after menopause, estrogen has gone down, so you are at increased risk of bone loss. Do you recommend DEXA scan or something?
100%. 100%. Every woman must undergo a DEXA scan. Fortunately, these days, with the era of preventive health investigations, a lot of people are now doing that. So with the blood investigations, you get a DEXA also done, a mammogram also done. So it's a good idea. Please
Get
do
DEXA
that.
scan. DEXA
Get a
scan.
DEXA
How often
scan
should we get it?
annually.
Every year.
Every year.
After
Every
40,
year.
after menopause.
After 40 years, an annual health examination is required. And in case your DEXA scan is showing osteopenia, it's important to be in a regular touch with your gynecologist and orthopedician to make sure that in case the scan is to be done even more frequently, then it should be done. So it all depends upon where your parameters are. And there is a proper,
Recommendation protocol.
protocol. There are a lot of drugs which we give in case we find that the person is grossly, osteopenic.
You give calcium, vitamin D supplements.
All that is very
Basic
then
thing.
of course we have a lot of other drugs like bisphosphonates
Correct.
and other things also. So but then I don't want to say the names so that people should not just think, oh, this is a drug I should buy. So let that decision be
Maybe the
taken
doctor,
by
yes.
a doctor.
Of course.
But understand that osteoporosis is reality. It's much more commoner than what we think. And unfortunately, in our country, I don't know what happens in US, it is diagnosed when a woman has a fracture and she comes, with a fracture, and then a DEXA scan or X-ray says, oh, she's grossly osteopenic. So please look after yourself. And smoking is one reason which causes osteoporosis.
Of course. I'll tell you an example in the US where there are two patients had. One patient had a hip fracture and the other patient had a knee strain or something. Both had osteopenia, osteoporosis. One of the patient is from an Indian immigrant, came from India after 20 years. And the other one was a white female who was there. Both had same age, same menopausal symptoms, but the white female got recovered much faster and from a knee sprain.
Okay.
Same kind of fall.
Okay.
Then I was telling I was involved because of fatty liver and everything. I was telling the person from the Indian community is that, see, the problem is that the other patient had a muscle mass protecting the knee.
Yes.
In your case, you were 46. We didn't focus on the muscle mass at that time by strength training. Let's say you would have done strength training, built some muscle mass from 35 to 45, the recovery rate might have been much easier.
So it's like, once again, it comes to this, please move your body.
Movement is big time. And hip fracture is the main thing, correct?
Yeah.
Elderly.
Yeah. Fracture neck femur.
Fracture from femur.
Neck femur.
Neck of the femur. And it can be very
debilitating. Very debilitating. It has a very, very stormy course also. So make sure that you don't reach that place in the first place.
Hopefully, audience will listen to this, do some kind of strength training and will not end up in that situation. The other thing very important in this field is bleeding. After menopause, there should not be any bleeding.
100%.
Right?
Yeah.
If there is bleeding, you should seek a medical attention right away.
Absolutely. So any bleeding post-menopause is not normal. So first of all, what is menopause? So which means for 1 year, you haven't had your periods. Now we officially declare you've gone into menopause. After that, any bleeding is abnormal and should be immediately reported to the doctor because of fear of malignancy. Period.
It's endometrial cancer.
Yes, endometrial cancer.
It's a possibility.
Even cervical cancers and everything. Cervical cancer, of course, all these things can happen in a premenopausal age group also. But post-menopause, any bleeding, please report to the doctor. And these days, going for a preventive health checkup is a good idea. Many times we pick up increased endometrial thickness on an ultrasound in a post-menopausal woman. So in case, before she has a bleeding episode, we pick it up then and there only. So if you can afford it, please go for an annual health checkup.
And you biopsy the endometrium?
Yes. So supposing in case, postmenopausal bleeding is an indication of a hysteroscopy. And endometrial sampling. And in case on the ultrasound, something is coming, which means that, your ET looks thick, or in case we see some growth inside the endometrium, inside the uterus, of course, we do the hysteroscopy and the endometrial sampling.
One of the other things I want to touch upon is breast cancer. Recommendation is mammogram at the age of 40 or 45? 40.
Annual screening mammograms.
Every year.
So a lot of people have this misconception that mammogram itself will cause cancer. So no, it's not like that. The risk of getting a cancer from a mammogram is much, 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 much lesser than missing a diagnosis of a cancer. So broadly, it is said that before 40, ultrasounds annually, after 40, annual mammograms.
Mammograms.
But again, it depends upon your history. Supposing somebody has a very strong family history, that your mother, your sister, everyone had a, breast cancer history, then of course we do, more intensive and more frequent screening for that woman.
I've been practicing for more than 30 years now. You think the breast cancer rate is increasing or decreasing?
100%.
Increasing.
It's so common.
So common.
So common. So very common.
At
So
what
very
age
common.
usually?
It's
What is the earliest age that you've seen?
24 years. And that too in a woman who was pregnant. It was like, I will never forget that patient. She just came, she was 6 months pregnant, and she said, I can, feel a lump in the breast. And then, the first thing is it might be just a milk duct or whatever. And then I palpate and I said, no, this doesn't look nice. And then, of course, we got a scan done. They said, no, this is doubtful. We biopsied. It was proven. It was an intraductal CA. And then, of course, we put the patient, because we couldn't deliver the patient earlier, we put her on some kind of a chemotherapy which could sort of control the growth of the cancer. We delivered her at 32 weeks. And then, a mastectomy was done and all that.
Pregnancy is supposed to protect from breast cancer. I'm sorry.
So it's a very broad thing. It is said that women who breastfeed their babies, breastfeeding has a protective effect.
Benefit, correct.
Women who have no children are at a higher risk of getting breast cancer. Women who've never breastfed are at a higher risk. Women who have a family history are at a higher risk. But Dr. Pal, you'll be surprised. Women who are diagnosed with breast cancer many times have no family history. They have 2 children. They have breastfed. So there's practically no reason why they have got breast cancer. So it's not that simple that, I have a child, I've breastfed, so I'm protected. No, it's not like that. Though, of course, these are,
Risk
sort
is
of
low.
the predisposing factors. But sometimes a woman may just get a breast cancer just like that. So once again, it's important that you go and get your annual health checkups done. It's very
and
important.
there's something called self-breast exam, right? What do they...
So self-breast examination is a good idea. But nowadays, we don't use this term like a self-breast examination. We say it's important to be breast aware. How does your breast feel? If we have to choose between not doing anything and doing a breast examination, it's a good idea. Every woman must do this. But we have to understand, by doing a self-breast examination, you can pick up lumps only which are more than 1 or 2 centimeters. And that too, if a woman is very careful, But, a breast cancer, in case it is detected at a stage where the lesion is just about 1 centimeter or so, the prognosis is much better, much better. So great, you do the self-breast examination, but it does exclude the possibility of not going to a doctor. Because even a doctor, when I do a breast examination, I can miss lesions which are less than 1 centimeter. And how can you feel with a hand?
With the hand, yes.
If a woman is obese,
Correct.
you are likely to miss it. But a good imaging will pick it up.
And obesity increases the risk of breast cancer.
Yes. Obesity, once again, smoking, exposure to hormonal, that's why at 14 years you give her
Birth
control pills. What are we doing? Rather than educating her and the mom, we are trying to make her completely dependent on an OCP forever for her life. This is not fair.
Birth control pills does put you at an increased risk of pre-cancer slightly,
But
not a lot.
again, having said that, we need to understand birth control pills are a great invention.
Of course.
They have revolutionized the way women have regained the control of their reproductive destiny. It's very important. But we need to understand that putting a patient on an OCP will not cure her of PCOS. Once in a while, I also put my patient on an OCP in case a person is bleeding, she has a lot of bad hirsutism, to let the situation get back to a point of a control. We can put that. But then telling her, let you take this and your PCOS will go away, that's a wrong notion. Right? So we need to OCPs are not bad. I mean, there's generally people say, oh, taking a birth control pill, even for a contraception, is bad. It's wrong. Birth control pills are very safe. Once again, they are taken on if they are taken on a doctor's prescription, not on your friend's prescription. It's important that you talk to a doctor, because today we have more than
Multiple.
100 types of a pill, and the doctor decides which pill is good for you and then puts you on that kind of a pill.
Of course. While we're on the topic, just wanted to touch base upon the most common contraceptive method that people are adopting right now. Is it intrauterine device?
No. It's not like that. It's like we have to understand that there is no contraceptive method which is the best contraceptive method. The day somebody invents a best contraceptive method, that person will get a Nobel Prize. More than a Nobel Prize. So every contraceptive method, starting from a barrier method, which could be a male or a female condom, or a birth control pill, or an IUD, or a finally sterilization and rings and pessaries and so many, everything has its own pros and cons, and the doctor decides that what is good for you. Of course, taking into account your consideration, your medical history. So once again, never take a pill just like that. Of course, for an IUD, you need to go to a doctor. Condom, of course, you can decide to use it. But once again, make sure that you use it responsibly. Use it carefully. Use it the right way. It's a great thing to do. It prevents a person...
Unwanted pregnancy.
Unwanted STDs, a very big
STDs.
thing. It is one of the best things which can be done to prevent an STD. So be responsible, educate yourself. In fact, when we started Maitri, one purpose was this: it's important to take control of your health in your own hand. Educate yourself, and educate yourself from the right sources, not because XYZ influencer who's not even a credible source is telling you. I mean, with due respect to everyone, it's like,
Of course.
you need to be sure, like, what you are following, is it really true or not? I mean, you would agree to this. On internet, it's full of information, but is that information really correct? It's most of the times very frivolous and very trash. So be very sure, make sure that you educate yourself, make sure that you find the right kind of a healthcare provider. And once you have found the right healthcare provider, trust the doctor.
Trust the doctor.
Wholeheartedly. That's very important.
No second opinion.
No second opinions. I know this is the problem which you and I face as a doctor. Every doctor is facing this. So take time to find your doctor. And once you found out your doctor, trust the doctor wholeheartedly.
My nephew is a doctor, and he saw a patient. He wrote his recommendations, and then that patient is a friend of mine. Sends me. What do you think about this? But this might be a very sensitive question, but I just wanted to ask you. I'm very curious. Usually what happens is after the second baby, if the second baby is a C-section, people actually consider doing a tubal ligation.
No, not really.
Not really?
Not really. It all depends. I mean, it's a what do I say? It's a time of reproductive autonomy. Everybody has
But if the family decides,
decide.
if the family decides that they don't want any more kids.
Yeah.
And
A lot of people do get it done.
Huh.
A lot of people do not also get it done. It's completely their decision. But doing a sterilization at the time of a second cesarean is a great idea.
It's a great idea. Yeah.
If you are very sure that come what may, I don't want a third pregnancy, we can do a recanalization surgery, but then the success rates of a recanalization are not that great. So it's important to take an informed decision when you go for this, a permanent method.
The point I was very interested was vasectomy. Is it being done, recommended? I mean, is it being adopted as a possible?
Very less in
Very
India.
less in India.
Very less. Once again, there is such a strong bias which is, against a woman,
Yes.
that, a
That's
man
all-
should not get this procedure done.
Exactly.
So vasectomy rates are very, very poor. Very poor. Even in upper class, like I deal with, women from the educated strata of society, there also.
Nobody talks about that. Not that much.
Yeah, even if they talk, they'll say, "Nahi, nahi, I'm getting a cesarean done. I will get it done."
Uh,
It's like that. So I said,
but let's say
okay, at least learn.
normal vaginal delivery. So 2 babies, normal vaginal delivery. Then the options are open.
Immediately post delivery?
No, what I'm saying is, family,
Huh?
2 kids.
Huh?
They decided we don't want any more kids.
Huh?
Okay, and the contraceptive method that is recommended is tubal ligation. I mean, not recommended. Let's say they are choosing tubal ligation. This is what happened to my friend. That's why I'm
So,
asking.
what
So,
we do is like in case after normal delivery they want a sterilization immediately, we can do it. It's called postpartum sterilization, wherein we need to give a very small cut. Otherwise, we do a laparoscopic sterilization 3 months later because
right.
by that time the uterus is involuted and gone back to the pelvis.
Yeah,
So,
what I'm trying to say is 3 months later, right? So
huh?
this is not a C-section. The
Yeah,
patient is
yeah.
not there. So it is not an easy option
Yeah,
of
yeah. She has to get admitted
get admitted.
again,
It's a surgery. It's a
and
procedure.
it's a much more bigger
Bigger procedure.
surgery than a vasectomy. It's a
Correct.
proper surgery.
Proper surgery. So
Yeah.
my point is, I think we should open up for vasectomy a lot more because the women is going through a lot more invasive procedure. There are so many good and bad things in US, mostly bad things, but but one good thing is vasectomy is very common.
Very common there?
Very
No,
common.
here the vasectomy rates are
Women will
very,
say
very poor. Very poor.
women will say, I'm not doing it. You do it.
No,
My
good.
urology doctor used to say.
Yeah.
He has practiced both in India and in the US now. He's saying that, vasectomy is extremely common. I think it's something very easy as well,
No,
relatively.
it should be. I think as men, they need to be educated about this. That it's a very small thing. The recovery is going to be very small. It's in all probability an OPD procedure, and it's a very easy thing.
Yes, very easy thing as well. One last thing before we wrap up is cervical cancer. Okay, Pap smear is something that we recommend where we
Scrape
scrape the cervical epithelium. When should we start? Just for the education?
Yeah.
Early.
So, cervical cancer screening should be done from the age of 21 years onwards, whether a woman is sexually active or not. And after that, it should be done every 3 yearly. In case we are combining an HPV screening along with that, 5 years. Yeah. And it's a test which is very easy to do, hardly takes 2 minutes to do. It's not painful, it's not expensive, at least in India. And it's a very easy thing to do. And once again, India has a very high cervical cancer rates. So once again, here women who are having a single partner, they also get this. So even if the risk factors could be multiple sexual partners and STDs, but I've seen housewives who've been into a mutually faithful relationship also getting a cervical cancer. So probably because in India we are not proactive in our screenings, women come to us very late when the cancer has already into stage 2 or stage 3. So a regular pap smear can actually pick up a cancer 7-8 years before the actual cancer develops. So cervical cancer has a very long history. So something known as CIN1, CIN2. So these are all precancerous stages. By doing a pap smear, we can pick up women in these precancerous stages, whereby just a simple local treatment, excision or a cryotherapy or an electrotherapy, can cure a patient completely. Once again, you need to get the test done. And today we have cervical cancer vaccinations, HPV vaccinations. So if you can afford the vaccine, please take the vaccine.
It's around age 12 or 13, right? When should we
So
give
the
it?
vaccine in India, it is 9 years onwards.
9 years.
Now, hopefully it should now become part of the national immunization program. Since it's a little costly vaccine, the government is working on producing an indigenous brand for the HPV vaccine. Once that happens, hopefully it should come into the national immunization program. But 9 years onwards, it is recommended. The best time to take this is 9 to 26 years. After 26 to 45 years, it is known as rescue vaccination. And beyond 45 years, it's useless. Yeah. Because the idea is by that time, you probably would have been exposed to HPV on your own.
This happens in my neighborhood a lot. Sometimes I have done this mistake as well, where during menstrual periods, right? Um, I know the menstrual cycle a little bit lot more because I recommend fasting, and during fasting around the menstrual period, they are craving for carbs because of the progesterone. Sometimes what happens is, what I'm feeling is that mental health issues are not being addressed seriously in women because people are thinking that it is that time of the month.
This is,
Correct?
she must be PMSing.
PMSing. How common is that?
Yeah, it is common. So women unfortunately face a bias at every stage. Biologically also there is so much they have to handle, and even as a society, they handle so much. So unfortunately, that's a reality. But now women are standing up for their rights and talking to them. Look, this is not a problem which I'm making it up. It is not. It is a real thing. It happens because somehow those hormonal changes, they interact with the neurochemistry and causing some changes there which make you more sensitive in your mood and your anger and all those things. So it's a real thing.
Real thing.
It's not you're making it up, and it's a proper entity, needs a proper treatment, and it can be treated pretty well. So in
It needs
case,
medical attention.
yes, of course. So there are various, grades to this. It could be premenstrual syndrome. It could be, proper dysphoric disorder where the woman is having a lot of mental issues. So in case you feel that it is affecting you up to that level, do not wait. Meet a doctor. We can put you on a lot of supplements, a lot of hormonal medicines to tide over that crisis. And once again, all those problems like premenstrual syndrome, PMDD, they have some bit of psychological, I would say,
Underlying.
connotation to it, that women who have these issues tend to, face these kind of problems more. Like, for example, postpartum depression will happen more in a woman who probably had a PMS. So underlying some neuro lability, exists. But having said that, it is not something which a person is making it up out of their own
Own thing.
own thing. It is a proper thing which varies from person to person and needs a proper medical attention.
Beautiful. It's a wonderful discussion.
I
Amazing.
know for a gastroenterologist, a lot of
New things. All I know is stomach and colon. That's so nice of you. You're doing a wonderful job. You're opening up a My3 online platform for women. What is that about?
So I started Maitri about 3 years plus, and I started this simply as an experiment to see, let's see
many
how does it
people?
go. And then, fortunately, a lot of people responded, and my only motivation was to create a good content which is scientific, which is evidence backed, but given in a manner which is easy to understand. And recently we got picked up by WHO as the Maitri is a voice you can trust. So that was the greatest validation
wow,
which
of
I
course.
got.
Of
So we are
course.
part of the WHO network now.
Beautiful.
And we are now, planning to scale it up and make it into a big platform where, pan India and hopefully later on also,
International as well.
women can actually access the authentic sources, authentic doctors, authentic care providers, everything which is like,
Credible.
ethical, credible, authentic. So, hopefully, we should be reaching there
You
soon.
will, of course, you
And,
will. Yeah, you will.
I really, we really want to help women, to empower them to take their health in their own hands, so that they are able to take the decisions, so that they are able to ask their care providers the right questions. Unless and until you know
Yeah.
what is correct, how would you
Correct.
ask the doctor what I
Correct.
want?
Correct.
And, once again, we hope to create Maitri a platform where you find the right answers to your questions, the medically correct answers, latest answers. So, at Maitri, we would never discourage you.
Beautiful. That's wonderful. What does Maitri stands for?
Okay. So Maitri is a Hindi word, and Maitri means friendship. So I wanted to create a friend which is going to be your friend and guide in the matters of your health. And I don't know if you've seen the logo. I wanted to give an Indian connotation to this. If you see, there is a bindi there, red bindi, which denotes the Indian connection. And it's a power of the strength of a woman. So that's how we made this. And today it makes me feel very, very happy that, globally, I think more than in 41 countries, people follow Maitri. And there was a very, I would say, a heartwarming moment for me. We recently got an email from a group of women in Middle East. They said that they get together in a kitty party to watch our videos. So where women are not allowed to even talk about these taboo subjects, there, Maitri is coming them and helping them and empowering them to take their own decisions when it comes to their health. So at Maitri, we talk about not only the periods and fertility, we talk about contraception, safe sex, breast health, basically anything and everything which a woman must know about her own health. I know we still have a long way to go. It's a very big subject, and we hope to continue working in this direction and hope to make the women more, independent and empowered to take their own decisions.
Of course.
That's
of
the
course.
motto of Maitri.
Beautiful, beautiful. I'm sure you'll do it, and you have done already a lot. Hopefully, I wish you best everything what you're doing.
And thank you very much, Dr. Pal. It was really insightful for me also. I'm waiting for those papers. Please send them
Yes,
to me.
we'll put that in the
And,
description, and we'll show that any guest who's coming in, I'm going to connect them with the gut anyways. That's when you're
No,
feeling with Dr. Pal.
no, it was a very, very good discussion, and I'm very, very happy that I came despite the rains and everything. It was worth all the effort. So thank you very much for even considering me to be part of your show.
Well, that's so nice
Thank
of you.
you.
Thank you so much.
Thank you.
Thank you. Bye.
Thank you.
That was a wonderful session. I'm sure you learned something at least from the podcast. As usual, I'm going to ask you to write down in the comment section in terms of what you exactly learned. It is extremely critical. This is a health podcast. It is not just a one-off podcast. It is just not for entertainment. I want this to be an infotainment where you actually learn something, absorb it, and then implement it on your daily lifestyle. So this is the goal of this whole health podcast. So for that to happen, all the points that you might have learned today, or you might have at least exposed to something new, I want you to write down this new concept in the comment section so that you will get registered in your mind, so that the thought gets registered in your mind and you will not forget. And that is how usually learning process happens. So please let me know your thoughts on the podcast session as well. So we have 2 more new YouTube channels, Gut Feeling with Dr. Pal Shorts, Gut Feeling with Dr. Pal Clips. Both these channels will be releasing videos in a shorter format of that 1 hour long podcast series, highlighting the salient features of it. So please consider subscribing to that channel as well. If you are an audio person, please check us out in Gut Feeling with Dr. Pal on Spotify while you're commuting, while you're driving. This will be a wonderful infotainment for you. Again, remember, one belly at a time. It is absolutely important. I'll see you in the next video.